All right, let's check again. Is the sound coming through now? So no sound right now yet. That's why we start a little bit early, do a little bit of troubleshooting, see if we can find out where the sound is. All right, let's check again. Oh, now there's sound coming through. Okay, cool. So I just talked a whole bunch. I told you all the most important stuff. I told you all the best stuff, and you didn't get to hear it. I'm just kidding. So I'm the licensed 3-on-6 provider in Las Vegas. But if you are considering 3-on-6, if you're considering full mouth rehab, the bottom line is you've landed in the right place. So we're just going to get right to it today. I have more questions than we can possibly get answered during this short 1 hour thing. Miss Daisy just said he's not live on Insta. So if somebody just wants to check that. And I can see that I am live on Insta because I can see it on somebody else's phone, Daisy. So keep an eye out for that. Okay, so for our users who are not familiar with 3-on-6, what is 3-on-6? 3-on-6 is a full mouth rehabilitation makeover option. I know that seems like a lot, but if you are considering full mouth rehab, like with an all-on X or an all-on 4, this is something that would fall into that same category as full mouth rehab. The difference is a 3-on-6 is a more superior option. It is where the patients get to keep their gums. So you keep your own gums, you keep your bone height, and you get a end result that looks more like natural teeth, functions more like natural teeth, and your experience of your prosthetic will be superior to anything else on the market. So why doesn't every office do it? That's one of the first questions we're going to ask today is if it's so much better, why isn't this the only thing that's offered? I can tell you that every month, the number of providers that are authorized to do a 3-on-6 grows substantially. We're adding new providers all the time to the network, which is a beautiful thing. But the surgery is more complicated. It's a much more involved process. It's a longer surgery, and you have to have a provider who is comfortable doing all aspects from the surgical component to restoring the teeth all at the same time. Because when you go to sleep for this surgery, you wake up with teeth. Now, that's one of the ways you can easily identify if you are getting an all-on X or if you're getting a true 3-on-6. The 3-on-6 patients wake up with teeth because while you're asleep, we contour your gums to your teeth and actually suture your gums around your teeth. That's why you can't come back the next day and get the teeth. You need to get them at the same time as surgery. So it's a much more involved procedure. However, the outcome is superior to the patient. And the reality is the technology just didn't exist. Even just a few years ago, the process is much different than it is today. And the bottom line is we didn't have the technology in place to really do this the right way until just the last several years. So my personal belief is that over the next few years, as more providers are becoming aware that this is now achievable and patients are asking for it, it will take over. And we will see a lot more providers offering a 3-on-6 type restoration as opposed to an all-on X. So let's just go right to the questions. First question I have here is it says, I'm freaking out. I just ate. I went to water pick my teeth. I saw some blood. I haven't had any issues. I have an appointment tomorrow for my follow-up. Please talk me off the ledge because I'm seriously freaking out. Well, listen, sounds like this patient has a 3-on-6 already. This was posted into a group chat for 3-on-6. They just ate and used their water pick and saw some blood. You know, especially during the first few weeks of healing, you're going to see some blood in your mouth. Once you start to use your water pick, I tell every patient, you start using it at 2 weeks, and you will be astonished at how much gunk comes out of your teeth, and it will also make your gums bleed, and that's totally normal. So if you're seeing some blood come out from an area, it tells us a couple of things. Number one, it tells us you had some inflammation in that area, and more water picking is actually better for it. Rarely does it mean something worse is happening. So I tell the story, if a patient comes into the office, into a regular dental office, they'll say, oh, I don't floss my teeth because it makes my gums bleed. And we tell them, well, I need you to floss a lot for the next couple of weeks. And guess what? The bleeding will slow down or completely stop. So same thing in your mouth. If you have a little spot that you've noticed some bleeding, it tells me there's probably been an area that's not getting cleaned very good. You've got a little soft tissue inflammation down there. So I would get real aggressive with your water pick and brushing for the next couple of days. And if it gets worse, just call your provider, call the office that did your 3-on-6 and get seen. But most of the time that's going to resolve on its own. So I'm sorry you're freaking out, but you don't need to be freaking out. Let's go to the next question. When you haven't been back to a 3-on-6 provider, only a regular dentist for your cleanings, what's the normal protocol to get your teeth cleaned? Good question. So half my patients fly in to see me from across the country. I wish I knew the actual number. I think it's more than half. A lot of patients are right here in Las Vegas, and I want to take care of your teeth. So if you're here in Las Vegas, come see us every 6 months. That's easy. If you flew in to see me, there's most likely not a 3-on-6 provider in your area, and you're most likely not going to want to spend that kind of money to fly out for your quick dental appointments. You're going to go to your local regular dentist for your cleanings. That's totally fine. We actually have an entire guide put together for these offices to help take care of your bridges. It's a guide for the hygienist or for the dentist, whoever's going to take care of it. So at the onset, you don't need to come back to us to have your teeth cleaned. You can go to any dentist and have your teeth taken care of and cleaned for every 6-month appointments. But what's the normal protocol? It's just normal implant maintenance. So any trained dental hygienist, they can be helping you keep the bridges clean, just using their normal protocol. One stark difference, I think, is in our case, we don't want you to floss under the bridges. This will break that little attachment, because right now we want your gums to attach to the bridge. That helps keep it clean underneath. So if you're constantly breaking that or cleaning it out, it can break that little attachment down there. So that would be one little bit of a difference. And most dental offices are scared of full mouth patients because traditionally they had to take off your entire all-on-X prosthetic, take the screws out, drill the holes out, take the screws out, take the device out, clean it, clean around the implants. That's just not the case with the 3-on-6. So it's much easier to get this prosthetic maintained locally. You really don't need to come back to us because it is such an easy appointment. We just had a question come in. Should I be using a threaded floss daily or just my water flosser? I don't mean to get too taboo about this, but you do not need to be flossing these teeth. In fact, I prefer you don't. I prefer you just use your water flosser. If there's a piece of food stuck in your temporary or your permanent teeth and you need to use a piece of floss to get to it, that's fine. However, as a general rule, you just don't need to be flossing. You're not going to get a cavity even in your temporary or your permanent teeth. So flossing in between them is not going to help us do anything. But using the water pick is where it's important because it keeps your gum tissue clean around your teeth and keeps that tissue really healthy so it stays hooked to the actual prosthetic. So as a general rule, unless there's a big area and kind of something unique in a patient's mouth, I actually don't have my patients flossing at all. They're just using the water pick, but I want you using that every morning and every night. So we want to make sure we use that water pick in place. So good question. Okay, another question from a patient. She says, serious question here. So she's very serious. Serious question here. Has anyone had issues with teeth falling out or screws coming out? Yeah, let's just talk about that. I've never had a patient with a tooth come out, but we have had patients that have screws come out. It's much more common in a temporary stage during your healing, but keep in mind, even then it's super uncommon. I can count on one hand how many times a patient has had a screw come all the way out. Ironically, one was this week. So a patient came in this week with a screw that came out. Most of the time, it's just because the plastic temporary teeth, they can go through some temperature changes and they can kind of contract and shrink with temperature. And so that can make that little screw, give it an opportunity to come loose. Super uncommon, but if a screw came out, it's no big deal. The whole thing is held in. It's a big bridge. So you just have one screw out of 5, 6, 7, 8 that are holding that bridge in place. So in your temporary stage, if a screw comes out, just call the office, let them know. It's really not that big a deal. We want to get it back in, but it's not an emergency. Now, can a screw come out of your finals? I think a screw could come loose or a screw could be broken, but coming out would be really uncommon because in your finals, the screw is holding the bridge down, but then there's a filling over the top of the screw. So the screw, even if it came loose, really can't come out. But the screw can come loose in your finals. That can happen. When that does, just call the office, let them know something doesn't feel quite right down here on my bridge. You could pop in the office, they could open it up. It's just a few minutes, tighten that screw down or put a new screw in it for you. So I'm glad you asked a serious question, but that's really an uncommon issue to have. Next question on the list. I don't have anything else up there. Perfect. Okay. So we will go with the next one on the list. Hello, friends. Hope everybody is having a blessed day. I'm back with another question concerning the mouth guard. Do I wear a mouth guard on the top and bottom? And do I get a custom night guard? So during healing, you are wearing a night guard. In fact, you're going to wear a night guard for the rest of the time you have teeth, the rest of the time you have bridges. During healing, it's a different type of mouth guard. It's just a boil and bite. It's just a cheap mouth guard you can buy on Amazon, or you could buy it at Walmart, wherever. And you only wear a mouth guard on the top unless your provider tells you something different because there's something unique happening in your mouth. But patients just need a night guard on the top. And at the conclusion of the temporary phase, when we put you in your finals, we're actually going to take a scan and make you a very nice custom night guard that you'll use for the rest of your life. So during healing, it's kind of just an over-the-counter cheap night guard, and it's just on top. And then when you go into your healing phase, you'll have a very nice custom night guard that you'll use. And again, that's also just on the top. So good question. Next question. I am still in temps, and I've had them break 4 times. Has anyone had this problem? Yes, you are not alone. Temps can break. Now, temps breaking is not the end of the world, but it does tell a story. So temps breaking tells us that you are either not following the soft food diet. It tells us that you have too much occlusal force, probably from clenching or grinding your teeth, and you're probably not wearing the night guard. So all of these things are telling the dentist or the provider something about your restoration. They're telling us that the occlusion's not right. They're telling us that maybe you need a different type of night guard. And so if you're experiencing broken bridges, if I have a patient that breaks a bridge, sometimes it's trauma. A patient came in the office not that long ago. They were doing some yard work and they slipped and kind of gritted their teeth as they slipped and they broke a bridge. No biggie, we'll fix it. If a patient breaks a bridge and doesn't know why, then we're going to start trying to figure it out. I can tell you that most of the time they're not following the diet, and they'll say it like, oh my gosh, I haven't been doing very good at following the soft food diet. That's on me. Or I haven't been wearing my night guard. That's on me. But to break it 4 times, that tells a pretty big story. I don't know exactly what's going on for you, but I would suspect that the occlusion is not quite adjusted right for you. And that should be a conversation with your provider. Hey, this is the 4th time. What's going on? Can we make an adjustment? What do we need to do? But also keep in mind that you probably play a pretty big role in this as well. What are you doing with your maintenance to make sure that you're taking care of these bridges while you're healing? So make sure you're wearing your night guard and make sure you're sticking to that soft food diet. Those are really important things. Oh, here's a familiar name. I know this name. Let's see. What can I say and not say? I can't say anything else other than that. Okay. This patient said, what can you do for stains on the teeth? Can you use baking soda? Yeah, so stains on the teeth, I assume we're talking about being in your finals. Zirconia really doesn't stain permanently. So if you're seeing some staining on the teeth, that means you're eating something or drinking something that could be staining the teeth and putting it there, but we can always clean it off. So the easiest thing to do, you go to the office and we'll just polish it off with regular, like a tooth cleaning, and just polish it off the teeth. But at home, you're welcome to use baking soda and water, but really any good toothpaste is going to be totally fine. The zirconia is super hard. It's like glass. It's not going to be staining. You're not going to do a deep stain. If you're seeing it, it's probably in like little grooves and the pits and fissures, they're called, inside the occlusion on the teeth. So that would just be totally fine to use some baking soda. That's okay. Any kind of regular toothpaste will do just fine. If you find that you can't get the staining out on your own, come into the office and let the office just polish it off for you, and they can remove that staining pretty easy. The other thing to keep an eye out for is you still can get some buildup, some plaque and calculus on permanent teeth, your zirconia teeth. So if you're starting to see some buildup and plaque on your teeth, that's also maybe worth a phone call to the office. Hey, I'm starting to see some buildup. Could I get an appointment to come in a little bit sooner and get this cleaned off? Real easy for us at the office to take care of that for you. So good question. And of course, while I did that, my phone locked. Okay, here we go. Oh, this question gets brought up a lot. I've seen it a ton lately, and we're just going to do our best to hammer through it. So this question is, can I get a grant to pay for my dental implants? I'm going to tell you the honest truth. I have never, one single time, seen a grant or a patient with a grant that covered even 1 penny worth of treatment. We literally just this last 2 weeks have been exposed to this even more. There's a clickbait scam going around on Google. So it'll say, see if you qualify for dental implants, see if you qualify for a grant, see if you qualify for an implant study. You're giving them all of your information, and then it pulls up a page and it just is listing a bunch of offices that do this kind of work. And my office happened to get on that list this time. We're listed with many other offices. We're not paying to be there. We didn't ask to be there. We do not want to be there. And then the patient's providing all their personal information to this marketing company that's clickbait. And then it just pops up and says, well, here's an office. And they call my office and we say, we have no idea what you're talking about. It's taken tons of work and energy and effort to finally figure out where this is coming from. We have some calls into Google even to see if we can get it to stop. But I can tell you that, unfortunately, I have never one time in professional dentistry heard of or seen a grant that does anything for a patient. I don't know of any implant studies you can participate in. And I wish there were. Believe me, if there were a grant, if there were studies, if there were anything my patients could get to help cover their expenses, we would be the first to offer it to our patients. We'd be the first to know about it. The only grant I've ever heard of was through the dental school for patients that wanted a denture, and the school had a private donor that was helping out with a few $100s is all. And that was back when I was in dental school. I've never heard of anything for implants or anything else. So sorry, I wish there were. Okay, 3 on 6 and 4 on 8. And then I hear that some patients have more or less implants. Yeah, let's talk about it. So 3 on 6 refers to 3 bridges on 6 implants per arch. So there's 2 arches in your mouth, a top arch, a bottom arch, 3 implants, 6 bridges. But we don't want to get hung up on any of those in particular. What do I mean by that? I have patients with 4 implants, 5 implants, 6 implants, 7 implants, 8 implants per arch. Everybody's bone is different. Everybody's situation is different. We also don't need to get hung up on how many bridges you have. I have patients that have 1 bridge per arch as their permanent. I have patients with 2 bridges per arch as their permanent, 3 bridges per arch, and 4 bridges per arch. So the hallmark thing that makes a 3 on 6 a 3 on 6 is not the number of implants. It's not the number of bridges. It is all about the soft tissue management and how your teeth look like they grew out of your gums. So in dentistry, we refer to this, a term that's been around for a long time. This is not unique to us. It's a textbook term, is FP1. So a 3 on 6 is a trademarked version of an FP1, which means natural looking teeth, natural size of teeth, as opposed to like an all on X would be an FP3. Now, I'm not trying to give you too much to think about or mess with your head too much, but in regards to this specific question, my goal for every patient is to get the adequate number of implants that you need to create stability for your teeth so you can chew on them, rely on them, and have a great bite. It's not contingent on the number of implants. So when you hear providers say, oh, it's a 3 on 6, or it's a 4 on 8, or it's a 2 on 6, none of that really has that big of an impact on your final outcome, nearly as much as really getting a true FP1 or teeth that look like they grew there. And that's the defining characteristic of a 3 on 6. So a 3 on 6 is a hallmark. The thing you want to look for is, do I end up with teeth that look natural? There's a question that I haven't been able to see that I'm hearing about.
It's called Nate the Great asked, how long is recovery after surgery?
How long is recovery after surgery?
From Nate the Great 500.
Nate the Great 500, talking to you, Nate the Great. Okay. There's the acute phase. So I do most of my surgeries on a Wednesday. Most patients are back to work on Monday. Now, I've had some patients that go back to work a day or two after surgery, even the next day. There's nothing necessarily preventing you from going back to work, but you did just have a major surgery, so you might be pretty uncomfortable. So the acute phase, most patients report that Sunday is the worst day for postoperative inflammation and pain. That's normal, but most patients are back to work on Monday. If you know your body and you need a few extra days off, that's totally fine to do that. But that would be the acute stage of healing. It's going to take 6 weeks for your soft tissue to completely heal in your mouth. And it's going to take 3 months for the implants to osseointegrate into the bone in your mouth. So the true healing phase really could be arguable that it's a full 3 months long, but the recovery from surgery, you'll be back to normal life, talking, chewing, eating, doing all your stuff within just a few days after surgery. In fact, most patients report it's better than it was when they started. Most patients have a pretty uncomfortable situation in their mouth. Maybe they're missing a lot of teeth, or they have dentures, they haven't been able to chew, or they're on a modified diet for the last 10 years. And within just the day after surgery, they already feel like their mouth feels better, especially if we're getting rid of infection and inflammation. So I hope that answers your question. Was there any other part to that question, or was that it?
Oh, that's it.
Perfect. Okay, let's go with this big long question. I'm just going to read it. I just started looking at 3-on-6. How are the gums treated? One question. Are they your own or fake? Okay, let's just break this down independently, sentence by sentence. I just started looking at the 3-on-6. Congratulations. Welcome to the 3-on-6 family. How are gums treated? With lots of respect and love. We want you to keep your gums. So when we are extracting teeth, when we are doing everything, we're thinking about your gum tissue as the kind of the foundation for what we're creating. So we are doing as minimal bone removal and as minimal soft tissue gum removal as possible. So how are they treated? We want you to keep them. So we're going to contour your gums to match your new teeth. That's how we're going to make your teeth look more natural. They're going to feel more natural. And that's one of the reasons why they're much easier to maintain, is because you are keeping your own natural gums. So are they your own or fake? They're your own. If you look at an all-on X and you have that fake gum area and then you have teeth, our patients don't have that. I wish I brought models with me to show, but go onto the website, go onto alloutdental.com, go onto 3on6.com. You can see lots of pictures comparing an all-on X to a 3-on-6. We want the patient to keep all their own natural gums. Also, how much time do you need to wait before you can have your finals put in? I think you're going to find across the board that patients are healing for 3 months. I have some patients that need a little bit longer. We'll have them in their temporaries for 4 months. I have some patients who are in temporaries for even longer that needed more complex things, sinus lifts and a bunch of other recovery things. But as a general rule, you'll be in your first set of healing temporaries for 3 months. How quickly can you get the surgery scheduled from the first visit to surgery? I can't speak for every office. I can tell you that here in Las Vegas, we're adding surgery days constantly and adding openings all the time. About this same time last year, we got booked up through the end of the year because everybody wanted to get teeth by Christmas or by the first of the year, which is totally cool. But we had a patient come see us last week and they're having surgery in a week or two. So we're always willing to and able to try to squeeze people in as we can. How quickly can you get the surgery from the first visit? So the actual question, from the first visit to surgery, I mean, it could be done in a matter of days if it had to be. The lab really likes 2 weeks to get prepared, and that gives us lots of time to get the planning done. But we've had times where we've had to get that done much quicker. So 2 weeks would be the general rule. 1 week would be pushing a little bit of a rush, but anything's possible. Let's just say it like that. Will the offices help with getting your health insurance to cover the procedure if it's possible? You just opened up a can of worms, and I'm going to do my best to talk about it, and I'm going to get in trouble with my office probably. I'm not allowed to talk about insurance, but I'm going to tell you right now, I've never heard of health insurance covering any part of this type of procedure, period. So getting health insurance to cover, unlikely. Getting dental insurance to cover something, possible. But keep in mind, most dental insurances are going to have a yearly maximum payout of $2,000 or $3,000. So even if they cover the most they're going to cover, it's a few $1,000s at the most. So in my office, we don't bill on your behalf. We will give you a master bill, and you can submit that to your insurance company and file for a reimbursement. But keep in mind, your relationship between you and your insurance company is between you guys. So every time we try to get involved, we're just met with a bunch of red tape. So one, what's funny? I saw an ad not that long ago where somebody was talking about, oh, we can get medical insurance to pay for dental implants, and they would pay up to $75 per implant. That doesn't even cover anything. So I don't know. I can tell you that in my office, we don't bill your medical insurance at all, and we don't bill your dental insurance, but we're happy to help you get every penny you can from those bloodsuckers. That's fine. Count me in. We would love to help you fight for everything you're entitled to. But we do that by providing you a bill, and you would give that to your insurance company, and then you would work with them to get a reimbursement amount back from them. So I wish that health insurance took dentistry more serious. The other problem we have with this type of procedure, it's mostly considered cosmetic or superior or high end. Dental insurance companies will even say, yeah, we'll help with that. We'll put a patient into a denture. Well, my patients don't want dentures. My patients are trying to avoid dentures. And so they consider anything besides a denture as cosmetic or a luxury. And that is what this surgery is. So most of the time, insurance companies are going to look at this and say, well, that's not a required thing. The patient could chew again with a denture, but that's not what most patients want. And that's not why they're coming to see me. So I know that's not exciting information to hear, but you're welcome to give us a call at the office. Let's just take a few seconds here and put that into the video. To get in touch with me, again, I'm Dr. Emett. I'm at All Out Dental in Las Vegas, Nevada. And you can go to alloutdental.com, or you can call us at 702-710-9006. We'd be happy to get you in for a consultation. We do a virtual consultation if you're not locally. That'll tell us a lot about your situation. And we try to minimize the amount of trips you spend and how much time it takes to come out and see us. So if we decide it's a smart idea to bring you out, you'll come out, you'll spend a few minutes with us doing a consultation and going over x-rays, but we're going to do your records on that same day and potentially even surgery just a few days later. So we try to minimize your travel time and maximize the time you spend with us here in Las Vegas. Okay.
There's a question about, do we qualify for FMLA, which is an HR question. I don't see myself going to work in a few days. So to qualify for FMLA, we would give you paperwork showing you had a procedure done, and you would have to submit that to your employer.
Yeah. I don't know if you guys heard that. I'm going to repeat what my staff just said. So does this procedure qualify for FMLA?
Which is family medical leave.
Yeah. So that's family medical leave. That's an HR question for you and your specific employer. What we do is we provide you with documentation saying this patient underwent a major procedure on such and such day. And then that would be a conversation for you to have with your actual employer to see what you do and don't qualify for there. That's all I have for that. I don't have much more of an answer.
And then how will my 3-on-6 implants age? Do I need to replace them after like 10 years?
Okay, so if you didn't hear that, question came in, how will my 3-on-6 implants age? Will I have to replace them like after 10 years? Did I get that right?
Mm-hmm.
Okay, good question. Thanks for asking. My goal is every patient that I put into a 3-on-6, it's a lifetime decision. It's done. We have implants being placed in the modern way since like the 60s, and patients still have those implants in their mouths. There's nothing that says that these can't last the rest of your life. Now, I will tell you that will be dependent on maintenance. Getting implants is not a free pass to stop brushing your teeth. It's not even a reset button. Dental implants take as much, if not more, maintenance than your regular teeth did. So you've got to do your part in keeping them clean every day. You've got to do your part in going to your appointments and making sure that everything's staying healthy. But if you're doing that and your implants are staying healthy, these implants can last the rest of your life. And that's what we want for every single patient. So can implants fail over time? Yes. Can implants have something happen and need to be extracted or replaced or redone? Yes, all those things are possible, but properly placed implants, properly done surgery, proper fitted prosthetics, the teeth, and proper maintenance, we expect that these are going to last your lifetime. And that's why if you go to even the alloutdental.com website or 3on6.com website, you can see that we have a lifetime guarantee. You can read all the details about that. But that's why it's so important to get your teeth cleaned every 6 months. It's not a money grab. I'm not making money as an office by having you come in every 6 months. We charge $150. It costs us almost that much to have the hygienist there to do the work. It's more about, there's not a lot of bad stuff that can happen in 6 months. If we start to notice some inflammation or notice an area you're not keeping clean, well, in 6 months' time, there's not a lot of bad stuff that happened. We can rectify it. If you start waiting for a year, 2, 3 years between appointments, and you finally come in and say, oh my gosh, I've had this going on for the last while, it's painful, I don't know what's happening. We look and say, well, you've just got some bone loss around that implant because you had some peri-implantitis and you weren't having it maintained. That particular implant might need to be removed or at least repaired. So yeah, it all comes down to maintenance. I want them to last the rest of your life. I tell my patients right to their face, I want this to last the rest of your life. And if you take care of it, I have no reason to suspect that it won't. But that's why it's important to make sure that you're doing your part as the patient in maintaining your new implants and your new smile. So good question. Thanks for asking that. Team, anybody else I need to go to from your side? Okay, we'll go back to the list. Let's see. How do you deal with dental phobic patients? I have been afraid to go to the dentist for the last 15 years. Look, I take this actually really serious. I don't know how this has happened, but we get a lot of dental phobic patients in the office. And I'm really, really okay with it. I think it's more about making the patient feel comfortable and what are their triggers. And so we're really highly trained at just asking some good questions. And then we're all about consent. I'm never going to walk in and say, open your mouth and just start poking around inside your mouth. I want to help my patients feel comfortable. And I do that by asking lots of good questions. But the next question is, how does a dental phobic patient go from, I won't go to the office for a dental office for years and years and years, to yesterday? There's a true story. I got to bring her on and just bring her on this podcast or this live sessions. So people just believe me. She is in my dental chair yesterday. She is a highly dental phobic patient, but she jumps in the chair yesterday, opens her mouth, and she's ready to have her teeth worked on. I think it comes down to, it's all about trust. And when I tell you that we're going to do something and we're going to do it a certain way, that's exactly how we're going to do it. We're going to help create clear expectations and clear communication so that you feel in control and that you feel like nothing's going to happen to you that you didn't want. I think most phobia, from anecdotally what I've discovered in my career, comes from a bad experience that happened to somebody in the past where some dentist said, you're fine, you don't feel anything, I've already given you all the numbing, you're fine, you're okay, and they just keep working anyway and they're experiencing pain. That's not what you're going to experience here. For your major surgery, you're asleep. You're not going to be in any pain. For your post-operative stuff, it's really minimal. You're not going to be in any pain. And we're going to rebuild your trust in that dental-patient relationship from the very beginning. So my team is really talented at helping you feel comfortable from the moment you walk in the door. But then we are going to ask lots of questions, make sure we understand why it is that you feel that way, and just make sure that we don't make you feel that way again. And all my patients are always in control throughout the entire process. So if we ever did something and you went, ooh, I didn't like that, we're going to stop and figure out what it was that you didn't like. It was a little pinch. Did you get a little sensation you weren't ready for? But I also think we do a good job of just telling patients, hey, this is what you can expect. During this appointment, this is what it looks like. This is what you're going to feel. This is what you're going to hear. This is what you're going to see. So it's all about education and helping patients through that. So good question. Does it hurt? We've talked about that a lot. Let's see, what else is on here? Oh, I think this is a very valid question. Somebody asked, what is included in a 3-on-6? Your answer to this question might be different based on which office you call and which provider you call. So I'm going to lead with that, but I'm going to tell you what's really included in a 3-on-6. So a 3-on-6 would be implants. Let's just call that 12 implants. It would include, in my office, bone grafting. So we're going to call this gap grafting, which means the implant goes into the bone. Is there any space around that implant that needs to be grafted? It would include some socket grafting. So any tooth that came out, what's going to go into the spot where those roots were, that will include some socket grafting. And then it may include some other grafting as needed, and maybe some soft tissue membranes as needed. What's not included would be like a ridge augmentation, or adding height or width necessarily to the bone. So your bridges are included. Your temporary bridges and your permanent zirconia bridges are included. Obviously, in my office, the surgery is included. So the sedation is included. We don't bill separate for sedation. We give you one price, and that's your price. So, there's some other offices where you get a price for your teeth, and then you get a separate bill for sedation, and that can vary dramatically. Sometimes patients are asleep for this procedure for 5 or 6 hours. Sometimes it's 7 or 8, maybe even a little bit longer. And sedation is super expensive. So there can be some varying costs with that. But in my office, that's all included. If you have a sinus exposure at the time of surgery, so I'm actually doing your surgery, I take the tooth out, we notice there's a sinus exposure, I will repair that sinus at that time. Most of the time that takes care of it, not all the time. And you may require a second procedure even after the surgery. That's not included. So a sinus repair at the time of surgery is included. So let's go down a list of common things that are like what's not included would be sinus lifts, soft tissue augmentations, and hard tissue augmentations. So adding a bunch of bone height and width, sinus lifts, those things are not included in a 3-on-6. So patients will say, oh, I got quoted X amount of dollars for my 3-on-6. And some patients will say, well, I got quoted $10,000 more. Well, that patient needed bilateral sinus lifts and a ridge augmentation and needed more substantial things, maybe even another surgery to get to the end result. So it's important to remember that everybody's situation is so dramatically different. It's really hard to compare what you need to what somebody else needs and what somebody else got. So I hope that answers that question. Do you guys have any other questions from your side? Okay. I want to talk about right now, we talk all the time about who is a candidate. And Dr. Roberts, the founder of 3-on-6, he'll say 90 to 95% of patients who are a candidate for like an all-on-X are also a candidate for a 3-on-6. And so why wouldn't you do the 3-on-6? But then the question is, who isn't a candidate? And I'm going to take a few minutes and talk about who isn't a candidate. So right off the bat, who isn't a candidate? If you have something in your health history that prevents you from being a candidate for successful implants, you're not a candidate. Smoking and the unwillingness to stop smoking or inability to stop smoking, poorly or uncontrolled diabetes, some type of facial trauma, or just a severely atrophic maxilla or atrophic mandible, which those words just mean severe bone loss in those regions, the top jaw or the bottom jaw, maxilla, mandible. So atrophic just means you have severe loss of bone there. Well, those patients aren't going to be a candidate for a 3-on-6. However, they're not going to be a candidate most likely for an all-on-X either. There are some very complex type treatments that could be available to patients that have an atrophic maxilla, even an atrophic mandible, like you'll hear a term zygomatic implant. There are some options for these patients potentially to get into a all-on-X type restoration, but by definition, they no longer would be in a 3-on-6 type restoration. So if you have a major health issue, major health concern that prevents you from being a successful candidate, history of IV bisphosphonates can cause some issues with healing. Maybe certain medications that a patient's on, or if you just have such severe bone loss that there's nowhere to put an implant into, those are the patients that just wouldn't be a candidate for a 3-on-6. Another question just came through. I heard on the 3-on-6 group chat that sometimes implants fail during the healing process. Okay, why does this happen? That's question number 2. And do I have to pay more? Question number 3. That freaks me out. Okay, so I heard on the 3-on-6 group chat that sometimes implants fail during the healing process. That's true. Depending on which research article you read, implant failure is anywhere from 6 to 12%, which means if you give a patient 12 implants, there's a 10% chance something's going to fail. That's a pretty high failure rate. Now, there's some things that we can do to help mitigate that risk, but implants can fail. Now, in my office, my failure rate, I wish Tiffany were on this call because she can tell you to the number, but I think it's like 1.35 or 1.45% of implants fail. But what happens when an implant fails? So an implant failing tells us that it didn't osseointegrate into the bone. And is this the end of the world? The answer is no. Now we just have to decide what we do about it. If it's the very back implant, either on the top or the bottom, we've got to put a new implant in. Most of the time, I need to get another implant back into that spot. So if an implant failed, most of the time we can just take that little implant and back it out. We can clean out the site where it was. And as long as there's good bone all the way around it, I can just put a new implant right back into the same spot, just an implant that's slightly bigger back up in that same spot. And that will most of the time take care of that failed implant. If it's an implant that failed up here in the front, we have some other options. We can, 1, replace it. We can, 2, take it out and skip it and never need it. Again, we're putting in 6 implants when we really only need 4. So we have lots of real estate that we can take advantage of. We have some extra implants if we need to. If this happens in my office, let's see. Oh, why does this happen? So that's a good question. I think that's what bothers dentists that do implants the most is why did it fail? And I want to try to figure that out. So most of the time, I can tell you it's something that the patient is doing. And I know that's not what you want to hear, but the reality is they're not wearing their night guard or they're not sticking to the soft food diet. There are some things that I can do to influence that. Obviously, implant placement can be important. Good soft tissue coverage is important. And also occlusal adjustment. You know, if I send you out of my office and every time you put your teeth together and bite, you're always just hitting on one spot or on one implant or too hard on one spot, that could put too much occlusal force on that one little implant and it could make it so it just never has a chance to heal into the bone all the way. So in my office, I pay for that. If it's something that that failed and it failed during your healing process, I bring you back in the office and we'll put a new implant in. We'll take care of it if we need to. If it's something you're doing, you're going to pay for that. Meaning you said you weren't going to smoke, but you decided you couldn't stop. I have a patient that did that and they smoked during healing. That's a pretty expensive thing to do during healing. If you're not sticking to the soft food diet. I have a patient that said, I just couldn't do it. It was too hard. It was over the holidays. I just wanted to eat regular food and I didn't stick to the soft food diet. I had an implant failure. Well, that's a risk that you were taking. So if you're following all the rules and you have an implant failure, I'm going to take care of it. If you're out there breaking the rules and have an implant failure, that's a pretty expensive thing to do. And do I have to pay more? That freaks me out. Yeah, that would freak me out. What was the question?
The hygiene. You didn't mention hygiene with them too.
Oh, and yeah, hygiene. I mean, you've got to follow all the rules about taking care of your teeth. So you've got to follow all the rules, soft food diet, wearing your night guard, using your water pick at least every morning and night, brushing your teeth at least every morning and night. So you have to be doing your part too to keep these implants healthy. Once we get them past the first 3 months, implants are really good. It's just that initial stage of the implant needing to osseointegrate into the bone. So yeah, good question. Thanks for asking. I hope that answered it. Any other question on your side I need to get to? Okay. I'll go right back to the list. We've talked about that. We've talked about that. I think that one's pretty covered. What colors can I pick? Man, I see so many people on the group chats talking about the colors of teeth. There's really only 4 colors of temporary teeth. There's one that's bright white. I don't like it that much. It is really, really white. Then the other ones all look kind of yellow to me. And then there's one called B1. I would say 95% of my patients are in B1. It's not bright white. It's still natural looking. It's a beautiful color of plastic teeth. So in your temporary teeth, there's only 4 colors, and B1 is what by far most of my patients are in. But in your finals, there are tons of colors. There's essentially an unlimited selection of shades and colors you can use. So in your finals, we're going to talk about how we want those to look. If you really want white teeth, we can give you white teeth. And I see people make comments in the Facebook chat sometimes, or even hesitant, like, oh, I see your smile and I think it's beautiful, but why is everybody's teeth so white? I spend a lot of time talking patients out of super white teeth. In your mind, you think, oh, I want perfectly straight and white teeth. I don't think you do. I think you want really straight and beautiful, natural looking teeth. If we make them too white, they look fake like a denture. If we make them natural looking, they're going to be beautiful. They're going to be appealing teeth, but they don't have to be white. We can do that with some different shading technique. So there's lots of shades you're going to hear about, like things like B1 and A1 and 1M1 and 2M1. But I promise you, your provider has the skill set and the ability to help you pick a shade that matches for you, that's going to help you accomplish the goals you have. So do I have patients that are in white teeth, like the color white of that thing? Yes, I have patients that are in white teeth, but not most of the time. Most of my patients are in a B1 or a 1M1 mix type shade. So I'm going to help guide you through that process to make sure you get the end result you want, and that's all that's important. This patient asked, during the healing period, is it normal for gums to recede and create gaps between the gums and the implants? Yes, that is a very normal thing to happen. Between the implants, that would be a lot of recession, but we are going to purposefully, during surgery, pull your gums up all the way around your teeth. We're going to suture them in place, even use tissue glue sometimes to hold them in place, because as gums heal, they always recede. So if we pull them up real high, they're going to heal down and recede. And that's why you're in a healing set of temporaries, is we're waiting for your gums to heal into their final spot. When we put you into your final teeth, we'll close off any of those open gaps. So patients will often see little holes in their teeth from where we suture through their teeth, and they don't see them in the beginning because their gums are pulled up over those holes. During healing, those holes become visible as their gums heal down away from the teeth. But I promise you, in the end, we go around and we recontour your final zirconia teeth all the way down into your gums for a nice natural looking gum line all the way across. So yeah, as you're healing, during the entire time, your gums are changing and they're just going into their final spot they're going to be. Most healing of soft tissue happens by about 6 weeks, but soft tissue will continually heal throughout the entire time you're in your temporary teeth. So good question. All right, so we've got about 8 minutes left here. I'm just going to go over a couple high-level things real quick. Again, I'm Dr. Emett from All Out Dental in Las Vegas, Nevada. I am a 3-on-6 authorized provider. And in my office, 3-on-6 is all we do. We don't do a single other thing. Somebody called the other day, well, they call out all the time, hey, I just need one implant. We don't have time in our schedule to even do single implants. I don't do crowns. I don't do anything else. We eat, breathe, sleep, the 3-on-6 procedure, and we help patients from across the country. And it's really been a privilege to be able to do this for patients. It's really a lot of fun. So we're here today talking about 3-on-6. If you're trying to get in touch with our office, we do free consultations. We do virtual consultations. We really do everything we can to help you guys make a good, educated decision. And I want you to know that when we decide, if you decide you are looking into the 3-on-6 procedure or you're looking into having this done, you get to meet with me personally. I don't care if it's virtual or you're in the office. You're never going to come in and just talk to a treatment coordinator or just talk to the office staff. We are going to sit down together. We're going to talk about what your expectations are, what's making you think you want to consider a procedure like this, and we're going to make a decision about the outcome. Can we give you the outcome you want? And you'll get an opportunity to talk to me personally and ask your questions. So if you'd like to get that scheduled, reach out to us, give us a call. We're always there to help. That's not true. We're not always there. We're closed on Fridays. Monday through Thursday, we are always there to help you. But you can always call the office at 702-710-9006.
Once you're a patient, we're always there.
I was going to say, yeah. And once you're a patient, we're always there. When you're a patient, the day of surgery, you get my personal mobile number. So if you ever have a question, you need some help on something, you just pick up the phone, send me a text, give me a call, I'll take care of you. It brings up a question though. Patients often feel like they don't have a way to get questions answered before surgery. And I see a lot of people going on the Facebook group and asking, I've got surgery in a week. What about this? What about this? What about this? At my office, I promise you, if you send a text message or if you called and left a voicemail or even just called in, even if it's on a Friday over the weekend, we're going to get back to you. We're really good at return calls. But why are we not there on Friday? Because we can. We don't need to be there on Friday. You don't need us there on Friday. I didn't hire some overseas call center. I'm not thinking this is an emergency that if you call the office to talk about 3-on-6, we're going to have somebody who calls you back within 10 minutes who doesn't speak very good English or can't communicate well or doesn't understand the procedure. Everybody in my office, this is all we do. This is every conversation we have every day is about 3-on-6. So when you call the office, when you inquire about getting a schedule for a consultation, whatever that is, just know that who you're talking to works in my office. I don't have a call center overseas. I don't have somebody working from home in some other state trying to field these calls and make sure somebody gets a call back within 10 minutes on a weekend. We're just not a high pressure, sales pressure type office. You're going to get a very knowledgeable, talented person on the phone whenever you talk to my office without any exception. And of course, you get a chance to come in and meet with me personally, and we can talk about your unique case. So there's about 4 minutes left. Do you guys have any other questions that came through on your side?
We're done.
I don't have any more that came through on my side. I just want to remind everybody that this is a privilege. I consider it a privilege to be in a role to help people on this pathway in their life. I love it. I love dentistry and I love my role in dentistry. And when a patient in my office yesterday is crying when she got her second set of teeth and stood up and gave me a big hug, it honestly made my day. It's what drives us and motivates my entire team, is just helping patients get to a new place in their life. Oh, real quick question. I'll try to cover it. Our hotel is reasonable in Las Vegas. We need to bring some with us. Hotels in Las Vegas are incredibly reasonable.
We have a corporate rate.
I have a corporate rate at a hotel that's right by us that we put our patients in.
We lived at for
Yeah, I stayed there for like a year when we were commuting back and forth. I've got a lot of nights logged in there. It's a great hotel. And flights to Vegas, somebody flew in the other day for $49. You can fly in and out of Vegas for super cheap if you want to do that. But yes, just give the staff a call.
You do need to bring someone if you have someone. If not, we'll help.
Oh, do I need to bring someone? So my staff is helping me answer that. But if you have someone, that's better. Bring them with you. If not, we are totally able to help you. We can walk you through what that process looks like. So anyway, we do have really good rate reserved with the hotel, and flights are super duper cheap. I think that's one of the reasons why patients come to see us from all across the country. If you got to travel anyway, listen, I always tell patients, go to the nearest provider. If you have a local provider, go there. If you don't, and you have to travel anyway, then let's get your travel expenses as low as possible and as easy as possible. If everything goes perfect and you never have to add an extra trip, that's great. But that's not always the case. Sometimes you might need an extra trip. You might need to go see your provider. So you're going to want to just go to the place that the travel is as easy as possible for you. So anyway, I'm glad you snuck that question in. Thanks for asking. Guys, I'm going to go ahead and end this right now. Again, love that I have an opportunity to help everybody down this pathway. And if you are considering a full mouth restoration, if you are considering having your teeth taken out and implants put in, you owe it to yourself to look at the 3-on-6 procedure. And I hope you consider talking to us here in Las Vegas at All Out Dental. Thanks for joining today. Talk to you soon. Bye-bye.